بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. This lecture is about inborn error of metabolism screening test. The lecture will be presented by Dal Ibrahim Wagalla, Assistant Professor of Clinical Chemistry. Objective of this lecture: to understand the importance of screening tests, to define the inborn error of metabolism and their biochemical aspects, to know the principle of the various screening tests done. Dozens of congenital metabolic diseases are now detectable by newborn screening tests, especially expanded testing using mass spectrometry. This is an increasingly common way for the diagnosis to be made and sometimes results in earlier treatment and better outcome. Because of the multiplicity of the condition, many different diagnostic tests are used for screening. An abnormal result is often followed by a subsequent definitive test to confirm the subsequent diagnosis. Common screening tests include ferric chloride test. This detects abnormal metabolites in urine. Non-hydrogen paper chromatography detect abnormal amino acid pattern. Gaussian test detect excessive amount of specific amino acid in blood. The dried blood spot can be used for multi-analyte testing using tandem mass spectrometry. First, we start with phenylketonuria screening test by using ferric chloride test. Here we can take 5 ml of fresh urine sample and add it 3 to 4 drops of ferric chloride solution. Phenyl pyruvate give green-blue color, which indicate the positive result. Also, phenylketonuria can be screened by dinitrophenylhydrazine test. Here we can take 2 ml of urine and add an equal amount of dinitrophenyl reagent and mix. Wait for 10 minutes. Appearance of yellow precipitate implies the presence of keto acid, phenyl pyruvate. The positive result is the one in the right side where the tube is become yellow and there is precipitate in the bottom of the tube. Also, phenylketonuria can be screening by Gaussian bacterial inhibition test. Bacillus subtilis is used in this screening test. Bacillus subtilis require phenylalanine for growth in culture in the presence of phenylalanine antagonist beta-2 cyanylalanine in culture media. Bacteria stop growing. Blood for normal infant is added, no growth of bacteria. Blood from phenylketonuria patient is added, bacteria proliferate since phenylalanine is not metabolized and present in high amount. Here we can see the result of Gaussian test. We can saw the zone around the spot of urine which is indicates the growth of bacteria. Alkaptonuria screening test. We can screen for alkaptonuria by using Benedict reagent. The result is give brown color if the urine contain hemogentisic acid. Ferric chloride test, immediate black color. Saturated silver nitrate test, immediate black color also. X-ray of lumbar spine give bumble-like appearance. Here we can see in the left the positive X-ray lumbar spine with the patient had alkaptonuria, and the right with normal result. Maple syrup urine disease screening test. Also we can screen for maple syrup urine disease by Guzri bacterial inhibition test. Azuleucine antagonist of L-leucine. Ferric chloride test give greenish gray color. Dinitrophenylhydrazine test also is positive in maple syrup urine disease. This is a urine for patient who have Alkaptonuria. The normal result or normal urine is in the left side. In Alkaptonuria, the urine is become black on long standing. So when we leave the container of urine for a long time, the urine automatically become black in color. Patient also may display painless bluish darkening of the out, ear, nose, and whiteness of the eye. Alkaptonuria can be screening by Benedict reagent, ferric chloride, saturated silver nitrate, and X-ray puncture. Lumbar spine, which is look like bamboo-like appearance. Now we are going to discuss how we screen the carbohydrate metabolic defect. First, we start with galactosemia. Screening for galactosemia can be by demonstration of reducing sugar in urine. Also, we can use Beutler enzyme spot test. Here, galactose 1-phosphate uridyl transferase activity is monitored on blood dried on filter disc with the aid of galactose 1-phosphate uridyl glucose, NADB, phosphogalactomutase, glucose 6-phosphate dehydrogenase, followed by measurement of the absorbance of reduced NADB under UV light. Here is the reaction. We can finally run or measure the reduce in NADPH by UV light. Also, this can be read Beutler enzyme spot. The spot indicates a positive result. The mucopolysaccharide screening test use Alcium blue spot test. Alcium blue is a copper physilycinane dye and contain positively charged group capable of salt linkage with certain polyanion, sulfate, and carboxyl radicals of the acid mucin. Here we take 10 ml of urine and write on a filter paper, and Alcium blue is added. Urine appear as a blue spot on the white background. This is result for mucopolysaccharide using Alcium blue dye. This all about the screening test. The common screening test used for inborn error of metabolism. Thank you for good listening, and see you in the next lecture.